Imagine your heart. It is a powerful, tireless muscle. It works every second of your life. A heart attack happens when this vital blood flow is suddenly blocked. The heart muscle cannot get the oxygen it desperately needs. Doctors often call this a myocardial infarction. Myo means muscle, cardial refers to the heart, and infarction means the death of tissue due to lack of blood supply. Think of it like the plumbing system in your home. Your heart has its own pipes, called coronary arteries. If one of these main pipes gets completely clogged, the area of the house it supplies stops getting water. Similarly, when a coronary artery is blocked, a part of the heart muscle is starved. This starvation causes damage. The longer the blockage lasts, the more severe the damage to your heart muscle becomes. This is why quick action is so incredibly important. We are talking about a true crisis for your body's most vital pump. The most well-known symptom of a heart attack is chest pain. However, this pain is not always the sharp stabbing sensation people expect. It often feels like uncomfortable pressure. Some describe it as squeezing, fullness, or a heavy weight on the chest. This discomfort might be in the center of the chest. It can last for more than a few minutes. It might also go away and then come back. Recognizing this specific type of chest discomfort is absolutely crucial. Do not dismiss it as just indigestion or muscle strain, especially if it persists or feels unusual for you. Beyond chest pain, there are other common signals your body might send. Pain or discomfort can spread. It might radiate to one or both arms, often the left. It can also travel to the jaw, neck, back, or even the stomach. Shortness of breath is another key indicator. You might find yourself struggling to breathe even when at rest. To understand what happens during a heart attack, we need to look at the heart's own blood supply system. The coronary arteries are the crucial vessels. They branch off from the aorta, the body's main artery. Their specific job is to deliver a constant supply of oxygen-rich blood directly to the heart muscle itself. Over many years, these arteries can become narrowed. This is due to a buildup of fatty deposits, cholesterol, and other substances. This buildup forms a substance called plaque. The condition is known as atherosclerosis. The actual heart attack event is often triggered by a sudden crisis involving this plaque. The surface of a plaque deposit can rupture or crack. When this happens, the body reacts as it would to an injury. Blood cells called platelets rush to the site. They try to repair the damage by forming a blood clot around the ruptured plaque. Section 4. Racing the clock. Why every second is crucial. There is a saying in emergency medicine, "Time is muscle." This phrase perfectly captures the urgency of a heart attack. Every minute that a coronary artery remains blocked, more heart muscle tissue is dying. This damage is permanent. Dead heart muscle cannot regenerate. The more muscle that is lost, the weaker the heart becomes. This can lead to long-term complications like heart failure. It can also increase the risk of future heart problems. Therefore, the primary goal of treatment is to restore blood flow to the affected heart muscle as quickly as humanly possible. Every second saved truly matters. This is why calling emergency services immediately is so critical. Dial your local emergency number, such as 911 in the United States or 999 in the UK, without delay. Some people might be tempted to drive themselves or have a friend drive them to the hospital. This is a mistake. Section 5. The numbers game: survival, recovery, and long-term outlook. Survival rates after a heart attack have significantly improved over the past few decades, thanks to increased public awareness of symptoms. Faster access to emergency medical services plays a huge role. Advances in treatments like clot-busting drugs and angioplasty are key. If a person reaches the hospital quickly, their chance of survival is often over 90%. However, a heart attack remains a leading cause of death worldwide. The outcome depends on the severity of the attack, speed of treatment, and overall health. Despite improved survival, a heart attack can have significant long-term effects. If a large area of heart muscle is damaged, it can lead to heart failure. This is a chronic condition where the heart cannot pump blood efficiently. Arrhythmias, or irregular heartbeats, can also become a persistent problem. Having had one heart attack increases the risk of another in the future. The extent of long-term effects is linked to the amount of heart muscle lost. This highlights why rapid treatment is vital. Section 6. Taking heart prevention, awareness, and moving forward. Prevention is powerful. Many heart attacks are preventable. Manage risk factors like high blood pressure, cholesterol, and lifestyle. Healthy choices and medical management lower heart attack risk. Regular checkups are key. Know your numbers. Discuss personal risks with your healthcare provider for a tailored plan.